In this video, I'm going to reveal how you can fix hip impingement from FAI with a corrective exercise program, and why surgery for FAI doesn't seem to hold up. I'm also going to explain why we think FAI occurs and what it means for your hip health. But first, tell me what has worked best for your own hips in the comments below. Hi, I'm Dr. Nicholas Mercer, physical therapist and your guide to a pain-free life. Femoroacetabular impingement, or FAI, can be incredibly painful and often causes a sharp pinching sensation in the front of the hip. In many cases, it keeps patients from living an active, healthy lifestyle. Walking, exercising, even sitting can result in unbearable, frustrating pain in the front of the hip and groin. In order to fix this pain, we first have to understand what FAI is and how it develops. Just a quick note, when I say fix, I don't mean that the bony overgrowth is going to go away. It won't. And that's okay. Thorough research has shown there is a large percentage of people with FAI and labral tears that do not have any symptoms. So if you can move and live without pinching or pain in the hip, I would say that we fixed the symptoms of FAI. Make sense? All right, let's look at some pictures now. FAI is defined as abnormal mechanics between the femoral head-neck junction and the acetabular rim, which can lead to pain and damage inside of the joint. This is thought to be caused by bony overgrowth on either the femur, which would be called a cam impingement, or the acetabulum, which is the socket of the hip joint, and this would be called a pincer impingement. Occasionally you can get both, where you have a combined impingement. But what causes it? Well, this condition is multifactorial. Genetics, early development, repetitive athletic activity, pediatric hip disease, and prior hip surgeries are all believed to be factors in developing FAI. So there's no one-size-fits-all cause of this condition. What we do know is that men are more likely to develop this condition than women. If one sibling has FAI, another sibling is more likely to develop it. People who participate in athletics in the developmental years, especially ones that require high impact or rotational forces, tend to develop this condition. People who had a hip condition in childhood, and finally, hips that have had prior surgery. All of these are factors that we see in people who have developed FAI. Regardless of the reason, you, the person watching this, is or knows someone who is struggling with pain from FAI, and surgery has probably come up as an option. This is known as a hip arthroscopy or resurfacing, where the surgeon goes in and shaves down the bone to make the hip look more normal. This surgery has been shown to be effective enough for some patients, with a little over half reporting mild or significant relief. And I'm not here to vilify surgeons or surgery as a whole. There's a time and place for them. Personally, I had this operation done on both of my hips. For me, it made my hips worse, and the bony overgrowth came right back. But I have heard people get success from this operation. There's something else I'd like you to consider though. Movement versus structure. How you move has a huge effect on your hips. Remember the definition of FAI? It was abnormal mechanics, not abnormal structure. The problem is with the mechanics of the body, which are not like the mechanics of, say, a car. Cars do not heal on their own, feel pain, or control their own movement. The human body is capable, to an extent, of adapting, healing, and changing without invasive methods. Surgery seeks to change structure, but what the body often needs is healthy movement. In addition, whenever a surgery is performed, it changes more than just the targeted structure. Scar tissue following the procedure permeates every single layer of tissue from the entrance point to the targeted tissue. The scar tissue is less elastic, weaker, and less mobile, and compensations around the scar tissue are likely to result in more pain, either in the hip itself or somewhere along the movement chain. So how can we avoid unnecessary complications of a surgery that isn't guaranteed to make your hips feel better? We optimize the movement of the hips through a structured, progressive exercise program. I made a video that can help you get started in 3 simple steps, which I will put as a card here and as a link in the description below. However, if you want to start a corrective exercise program designed specifically for people suffering from FAI and labral tears, you can download the free You Improve PT app, which I've included a link in the description below, and start the Pain to Perform FAI and labral tears program. The first week of this program will teach you how to control your abdominals, release your piriformis, and start controlling the tilt of your pelvis. I designed this program to be easily accessible, simple, and effective for people suffering from FAI and labral tears. So click the link in the description, download the app, and access the first week of the Pain to Perform FAI and labral tears program for free. I hope this video helped you understand FAI and the consequences of surgery, but most importantly, I hope it starts you on a journey to a pain-free, healthy life. Make sure you tell me your FAI story in the comments below. Thanks for watching.